Welcome to Professionalism and Customer Service in the Healthcare Environment, Communications and Professionalism. This is Lecture B. The objectives for this lecture are to describe appropriate uses of personal communication devices in the healthcare workplace and discuss common Bring Your Own Device, or BYOD, policies and practices in healthcare organizations and their implications. Limit non-work-related communication during work hours. Text messaging and email may be used by your organization to support business communications. If so, then you should use them only as directed and for the purposes indicated. Also, keep your work communication on your work email account and your personal communication on your personal account. Avoid forwarding jokes, chain letters, images, and other types of non-professional email to colleagues. They aren't appropriate in the workplace and can pose a danger to the organization if they contain malicious content. Many organizations use social media, such as Facebook, Twitter, LinkedIn, and YouTube for business purposes. However, some organizations prohibit employees from accessing social media sites during work hours because it's seen as decreasing productivity. Be aware of your organization's policies. It's also important to note that some businesses have fired employees who made inappropriate personal postings to social media, including negative comments about their workplace. Employees have also been fired for being active on social media when off work due to illness. You should also be aware of your organization's policies on general Internet use. Uploading and downloading of materials should be done in accordance with organizational policies, intellectual property rights, and copyright laws. Any type of Internet use at work should be performed responsibly and professionally. Many organizations monitor Internet activity of employees. Remember that what you say and do online reflects both on you as a professional and on your organization. Both can be negatively or positively impacted by your behavior. Inappropriate use can result in disciplinary action or even the loss of your job. Communication devices are part of a broad category of handheld, mobile, and desktop devices that are used to relay information, such as text, audio, or video, through a particular channel from a sender to a receiver. Examples of communication devices are phones, pagers, tablets, laptops, and desktop computers, each with various and sometimes overlapping capabilities and purposes. For instance, a basic wired telephone is used for voice conversations, whereas a smartphone has additional functionality such as Internet access, text messaging, and a camera. Work-supplied communication devices are the property of your organization and are given to you to use while executing your professional responsibilities. Be aware that the use of these devices may be monitored to ensure they are used according to the organization's policies. You have no privacy rights while using these devices. Your organization can legally and justifiably require that you use them only for work purposes. Be sure to keep all of your communications professional. Personal communications during work hours can be a source of trouble and annoyance if you make excessive use of any device for personal communications. This can interfere with your productivity and the productivity of those around you by being a distraction and taking your time away from your work. Be aware and respectful of those near you who may not enjoy being subjected to your conversations. Having to listen to coworkers' incessant ringtones and then to their personal conversations ranks as one of the worst workplace annoyances. There are special concerns in healthcare about communication devices that aren't shared by other organizations. For instance, employees should never use their phones to take pictures or videos at work. Taking pictures or videos could violate the privacy rights of patients and other employees and is considered inappropriate. Their use may also be expressly forbidden by your organization. This can also increase risk to your organization if a patient feels that he or she has a right to file a lawsuit for privacy violation. It's your responsibility to be aware of these concerns and to comply with all related guidelines and policies. There's a trend called BYOD, which is blurring the lines between business and personal communications. It stands for Bring Your Own Device. As part of this trend, organizations are no longer issuing company-owned equipment such as phones, pagers, laptops, and tablets to their employees. Instead, employees are being allowed to use their own personal devices at work for the purpose of business communication, such as checking their work email or work calendar. This practice leads to the blending of personal and corporate data on personal devices that are outside the typical control of IT. Both clinicians and IT professionals may value the benefits of using their personal devices to gain efficiency and accessibility in the workplace. The first thing employees often do on their smartphone is set up remote access to their work email. Clinicians say that greater accessibility and mobility lead to better delivery of patient care. For example, nurses typically love having the ability to use texting to get timely responses from physicians. And many physicians are more than willing to give up their corporate pager and shift to their smartphone or tablet. The implications of the BYOD trend in health IT has many facets. According to Jake Hughes in his article, Bring Your Own Device or Bring Your Own Disruption, one of the critical ingredients for a successful BYOD implementation is the end-user experience. When done right, the technology is non-disruptive for the end users and satisfies IT security needs. Allowing BYOD is seen as supporting the healthcare professional, which leads to increased technology adoption rates and reduces the need for end users to find workarounds to the security policies. However, if the BYOD implementation doesn't consider the needs and workflows of clinicians, then it places the organization at increased risk as clinicians seek shortcuts. The expectations of the clinicians, intuitive and end-user friendly, and IT, stringent security, control, and visibility, are typically at odds. Healthcare organizations and their IT departments have had mixed reactions to the BYOD trend. An advisory board survey indicated that about a third embraced the trend, another third was trying to restrict it, and others were trying to figure out how to manage it. In a 2015 survey of 100 health IT leaders conducted by Vocera Communications, 64% said their organization supported BYOD either explicitly or by default. When asked to predict trends, 56% said that they, quote, expect their IT policies will become more accepting of BYOD in the near term, and 68% indicated that BYOD will be fully supported in their organization by 2018, end quote. Another survey of 450 healthcare organizations published by Spoke in 2015 found that 73% of the organizations allowed some form of BYOD and 27% didn't. Health IT thought leader Dr. John Halamka believes that BYOD is here to stay. Describing the challenges, he adds that, quote, CIOs have limited authority but infinite accountability, end quote. Even organizations that have developed and implemented a BYOD policy can't be totally assured of IT security. Developing and implementing a BYOD policy is hard work and must be comprehensive. It's not a once-and-done event. It must be continually reviewed and updated to reflect the latest advances in technology and associated risks. It must include mobile device management for control and automated provisioning. The network architecture must also take into account security and resources in support of personal and mobile devices. BYOD policies typically allow employees to use a personal device to access work-related information. However, they also contain language that allows the IT department to track each access and remotely wipe the device should it become compromised. The employee needs to agree to the terms of use and to be periodically reminded of them. The IT department must ensure follow-through as situations warrant. Another consideration with the BYOD trend is the support implications. Providing health IT support was a challenge even when clinicians were using a limited number of company-supplied devices, phones, tablets, and pagers. With BYOD, the burden on the help desk is to provide customer support on countless types of personal devices, operating systems, remote access methods, and mobile applications. The knowledge base that's needed to provide customer support in this environment is dramatically increased. Security is another concern. There's been a dramatic increase in the theft of electronic devices, such as tablets and smartphones. In healthcare, BYOD organizations are providing remote access to the company email and EHR systems. One misplaced smartphone or tablet owned by a clinician can lead to a reportable HIPAA data breach if the device was not secured properly. Also, clinicians are now able to sync files, such as X-ray images and EKGs, between devices, which leads to better patient care. However, these files need to be automatically encrypted and deleted to avoid accidental exposure errors and HIPAA data breaches. Health IT plays an important part in developing and implementing a BYOD policy that is proactive about the risks that exist. This concludes Lecture B, Communications and Professionalism. In summary, limit personal communications at work to maintain professionalism. Many clinicians welcome the opportunity to use their own devices at work. However, with the BYOD trend comes increased risk and complexity if organizations don't manage it appropriately. Learn about your organization's policy on the use of communication devices, personal and business, internet use, social media, and other communication vehicles. Compliance enhances how people view you as a professional and contributes to a safe and productive workplace. Non-compliance and policy violations can have serious consequences to your employment and the healthcare organization.